And so our big umbrella that we're talking about, last time we talked about the big umbrella of antihypertensive drugs. We're going to talk about the big umbrella of anti-anginal and vasodilating drugs. So angina is chest pain. And of course, if we need something vasodilated, then it means it's vasoconstricted, right? If your vessel is vasoconstricted, it may result in two things. What do you think those two things are?
If it's
hypertension. If those vessels are constricted, we're hypertensive, right? And also, it's going to increase our risk of stroke. It's going to increase our risk of feelings of chest pain, all kinds of things like that. Okay, so we might give vasodilating drugs for chest pain primarily, and also for extreme high blood pressure. Okay. All right. So, angina is acute pain in the chest resulting from a decreased blood supply to the heart muscle. So, angina, chest pain. Atherosclerosis is a disease characterized by deposits of fatty plaque on the inner walls of arteries. So remember I showed y'all my cup earlier? Atherosclerosis is gunk built all around this wall. Gunk of usually fatty stuff, and also it's causing high cholesterol. So when our arteries have gunk all around the outside and it hardens, that's atherosclerosis. Based on what you know, if this vessel narrows, what is happening to our blood pressure? It's going up because pressure's because that lumen is smaller. Yes? Everybody understands that? Okay, so these drugs are going to be given a lot for patients with atherosclerosis and angina. All right, so we talked about it's really easier if you make, I hate to be like umbrella, this, if you kind of keep boxes in your head for all of this stuff, or it's going to start to all run together, okay? So the way I showed y'all antihypertensives with the umbrella, so anti-anginals can either be nitrates or calcium channel blockers. Those are your two classes, your subcategories underneath that big umbrella, okay? Your examples of nitrates, you'll need to know these, are isosorbide and nitroglycerin. We're going to do a lot of teaching to our patients about nitroglycerin because it's the mainstay dilator and with acute chest pain. It's the mainstay of treatment. Calcium channel blockers. Remember they end in PINE. Y'all already know that. And the outlier is diltiazem. Okay. So if from here I said, what drug might be used to treat both high blood pressure and angina? Well, they probably all would, but calcium channel blockers are under both of those umbrellas, right? Nitrates aren't going to be our mainstay of treatment just with regular hypertension. All right, so we're talking about nitrates. Nitrates act by relaxing the smooth muscle layer of blood vessels. They increase the size of the lumen, and they increase the amount of blood flowing through those vessels. So just think nitrates, it's getting way bigger. It's dilating that blood vessel, it's relaxing the smooth muscle, and it's dilating that vessel quickly. They relieve pain of acute anginal attacks. So nitroglycerin, raise your hand if you've heard of nitroglycerin. Y'all heard of that? Nitroglycerin, usually it comes in several forms. It comes in a paste, a spray, a little pill in a tiny dark bottle. Your patient, when they have chest pain, they put it under their tongue. And the goal is to relax that smooth muscle, decrease that angina attack. They can repeat it again in 5 minutes. Take another one. If by that second one, they're not getting relief within 5 minutes, they have to call EMS because this nitrate is not relaxing those arteries. It's not relaxing that smooth muscle, and they're very likely having an acute heart attack. Okay? So nitrate is the mainstay of treatment for acute anginal attacks. It's very important. Adverse reactions. This is important. Headache. Your patients, when they take this medication, it's usually not a maybe they're going to get a headache. We're dilating vessels quickly, and so it's like a whoosh of blood to their brain. Okay, you can think of it in that way just to help you remember that it's going to cause a headache. It also may make them very dizzy, and it may make them weak and restless because we're going from one extreme to the other, right? We want quick treatment for that anginal attack. They may also have hypotension and flushing. Those are commons with that. All right. So nitrates are contraindicated in patients with a known, see, this is where it starts to be real wordy, but I'm going to just break it apart slowly and it's going to all kind of make sense to you guys. Remember the box that I showed you on the, when we were talking about the last chapter? If you look on page 412, there's another little box with interactions. That's where this is being pulled from, okay? So nitrates are contraindicated in patients with a known hypersensitivity to the drug, those with anemia, closed angle glaucoma, postural hypertension, with an early MI, head trauma, cerebral hemorrhage. So if your patients, so let's just kind of break this apart and you don't know any of this stuff and I'm giving you a multiple choice, and it's multiple choice on the NCLEX. Based on what I told you, it's dilating those vessels quickly and it's increasing that blood flow. It would make sense that we would not want to give this to a patient with a cerebral hemorrhage, right? Because we're going to worsen that hemorrhage. And does that kind of make sense? Even if you don't remember all this by heart, this is where you start to use your nursing brain for the process of elimination, okay? So cerebral hemorrhage, allergies to certain adhesives, we're not going to put our patient on the transdermal patch. If they're pregnant or if they have, already have issues with postural hypertension, all those things, I would expect you to use the process of elimination if those questions were answered or asked. We're going to use them cautiously in patients with hepatic or renal disease, head trauma, acute MI, hypothyroidism, and during pregnancy and lactation. All right, so the mainstay, everybody say it together. The mainstay of treatment of acute chest pain is what? Everybody unmute, we're talking for a minute. On the count of 3, the mainstay of treatment for acute chest pain is nitrates. Nitrates, y'all are killing me. No, nitrates. That's why I want y'all to say it with me, okay? Because if I'm making you repeat it, then I need you to know it, okay? It's not because I'm being annoying and I like to hear my squeaky voice. The mainstay of treatment for acute chest pain is
nitrates.
Nitrates. Nitroglycerin, primarily. Nitroglycerin is the #1 treatment. It might cause a what?
Headache.
A headache, yes. And it may cause your pressure to do what?
Drop.
Drop quickly, right? So based on what you know, your job as a nurse is to keep your patients safe. Okay, they don't need to be walking through Walmart when they're popping their nitro. They need to sit down for a minute, okay? Headache and hypotension are your main 2 things with that. All right, now we're talking about, so that's our big umbrella. Nitrates was the first one. All right, now we're talking about calcium channel blockers. Calcium channel blockers were also used as an antihypertensive drug. but they're also going to be used for angina, which is chest pain. So anginal pain associated with certain forms of angina, such as vasospastic angina. So vasospastic, we know what a spasm is. If we have a vasospasm, it's going like this, right? That, right? Because we're squeezing and we're blocking off that flow. Or we might have a patient who had a heart attack, because every time you have angina, you're not having a heart attack. Sometimes there's previous damage there, and you've had a heart attack, and your body still responds to that. It's been fixed, and it's been, they had a bypass, but those vessels still may sense that they're not getting enough oxygen. That is a cause of chest pain. It's usually the body sensing a lack of oxygen to certain vessels in the heart. So calcium channel blockers are going to be used for those vasospasms, and they're going to be used for chronic stable angina. We understand the difference between acute anginal attacks and chronic stable angina. Acute is right now, it's happening, it's immediate, it's out of the blue. Chronic stable angina is I have a little chest pain and I've had it off and on for 2 years. We understand the difference? Okay, so calcium channel blockers are going to act by inhibiting the movement of calcium ions across cell membranes of the cardiac and arterial muscle cells. They're going to affect, when they do this, they're going to affect the heart by slowing conduction velocity of the cardiac impulse. So remember when y'all learned, I'm going to pause for a second. Remember when y'all learned about the AV node, and y'all learned about, do y'all remember the Purkinje fibers and the electric flow of, the electricity flow within the heart? Did y'all learn that in A&P? Okay, so whenever this is normally happening and it's causing a contraction, we're moving down the Purkinje fibers, contract, moving, contract. Calcium channel blockers, let's reread that together now that you know that. It's inhibiting the movement of calcium ions, and it's going to slow the conduction velocity. And then from there, that impulse is it's going to be relaxed. It's not going to be just firing. So it's going to depress, it's going to make that heart muscle not as excitable. So that contraction is going to be a little less. It's going to almost make the heart not as sensitive. Does that kind of make sense? It's not as sensitive to those impulses. It's chilling it out. It's like, okay, I feel those impulses, but I'm not going to act on them. And that's going to decrease those spasms, and it's going to decrease, that instance of feeling chest pains, because they're not going to be having those spasms. It is a drug that is used for many things, though. Calcium channel blockers are used for angina, stable angina. They're used as regular antihypertensive drugs, and they're also used as, what's it called? Hold, please. Antiarrhythmics. If there's an irregular heart rhythm, they're sometimes prescribed for that as well, because they decrease that contractility. They chill out the heart a little bit. So calcium channel blockers are in all 3 of those umbrellas. All right, side effects of calcium channel blockers are dizziness, lightheadedness, headache, nervousness, loss of muscular strength, and fatigue. They can, almost all of these meds can cause nausea, constipation, and abdominal discomfort. Sometimes they can cause edema, arrhythmias, and bradycardia, because, we're chilling the heart out. We might chill the heart out a little too much, right? We might drop that pressure. And they can always cause rash, flushing, nasal congestion, and cough. What did Miss Adams tell you guys to think of when y'all thought of calcium as far as the body's response? What was the main thing she told y'all?
she said to think about like your body being lazy.
Tell me again, Kelsey, I didn't hear you.
She told us to think about like your body being lazy. So it was
Being
like,
lazy, you said?
yeah, that was just something she told us to
Okay.
register.
And the reason I'm asking y'all what she told y'all is because I want to bring it into this, and I don't want to use a different example than what she used. So if she told you to think about your body being lazy, if you look at those CNS reactions, that kind of goes hand in hand with that, okay? Fatigue, headache, just kind of just feeling kind of yuck, lightheaded, dizzy. Those things are going to go along with the adverse reactions for calcium channel blockers. If you want to try to connect her class and my class together, just to kind of keep your thought process similar, okay? All right, they can, again, almost every drug causes nausea, constipation, abdominal discomfort, or has the potential to. We talked about all that already. I think that's a duplicate slide. All right. Calcium channel blockers are contraindicated in patients who are hypersensitive to the drug. Those with sick sinus syndrome, second and third degree AV block. So we're just going to use our process of reasoning here. When we talk about second and third degree AV block, remember the atrioventral, do y'all remember this stuff? When I say you remember and y'all don't remember, y'all remember learning about the flow of electricity through the heart, and you have the SA node and the AV node? So if they have a block there and we're slowing that conduction, we're chilling the heart out, it would make sense that we wouldn't want to give that to those patients, right? Even if you don't remember all this stuff by heart, those are the things that you gotta, because I know as a teacher, I know that you're not going to remember everything on every one of these slides, because I can tell by y'all's faces that it's already running together. Yes? It's already starting to sound like exactly the same thing that I said before. So you got to pick stuff out that you can remember forever. You got to pick it out. And then when you're taking tests, you got to think, okay, I know this, so this is probably true as well. This is where y'all got to start using those reasoning skills. So we can, based on what we know, it makes sense that we wouldn't give these medications to people with AV blocks. And we wouldn't give them to people who already have a systolic blood pressure of less than 90, because we're going to decrease it further. And we're going to give it cautiously to patients with heart failure, hypotension, renal, and hepatic impairment. We are almost going to always give every drug cautiously in patients with hepatic and renal impairment, okay? All right. Remember I told y'all about the interactions that could be found. This is more interactions. They're on page 412. So they can increase, some drugs can increase the effects of calcium channel blockers. These drugs can increase the toxic effects of theophylline. St. John's wort, I want y'all to make a note of that. A lot of people, I say a lot of people, it's not as common as it used to be, but that was a big herbal drug that was used for a long time as hypertensive treatment. So when a lot of patients would take that on the side, and they wouldn't necessarily tell their physician that they were taking it, and it kind of canceled out their calcium channel blockers. So we need to know if a patient is on St. John's wort, okay? And know that these drugs can increase toxic effects of theophylline and digitalis. All right. Nitrates can interfere with alcohol, aspirin. Basically, these are just further interactions. And whenever I start to look over that stuff, I'll try to pick out some super important ones for you to remember, because I'd rather you remember, 10 super important interactions than try to memorize them all and not really remember any of them at the end of the day. So I'll try to pick that out for you. All right. So as a nurse, I'm going to be pausing this. I'm not going to read these slides, and we're just going to talk for the next 8 minutes about what you think you need to do as a nurse. Without reading these slides, y'all have to talk back to me, and you have to tell me what you think you're going to do as a nurse and what some of their diagnoses might be, because all this last 15 and 20 slides are the nursing process. So rather than me telling you the nursing process, I want you to tell me the nursing process, okay? So I'm ending my slide, and I'm gonna talk to y'all for 7 more minutes. Let's see. And we might have to start in class at 8 instead of 8:30. I'm trying to stop presenting. Or maybe at least 8:15, because I thought I was gonna have more time today. Okay, so when we're talking, try to do it without looking at your slides. Big umbrella, anti-anginals and vasodilators. They can be one of two. There's 2 things underneath that big umbrella. All right, what are they? Nitrates.
Calcium.
And calcium channel blockers. And then there's also peripheral dilators. There's peripheral vasodilators, which are going to be for severe hypertension. If you want to put those as a third thing, they'll be for severe hypertension. Because if hypertension is severe, then we want to vasodilate quickly. Examples of major vasodilators are hydralazine. You want to write that down? HYDRALAZINE. And minoxidil, MINOXIDIL. Those are some examples of those. So as a nurse, all right, your patient is coming in, and I'm going to be your patient. Oh, let's see, who do I want to pick on? Does anybody like to be? Okay, Carly, you were smiling, so you win. All right, Miss Carly, my chest hurts really, 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 really bad. It hurts really, really bad. As an assessment, what is something that you can ask me?
Where does it hurt?
Where does it hurt? What is something else that you can ask me, Brendan?
When did it start hurting?
When did it start? Yes. So we are not just saying, oh, my patient's got chest pain. I want to know the quality. I want to know how it hurts. I want to know, is it stabbing? Is it sharp? When did it start? Is it with exercise, without exercise? All of those qualities about chest pain, okay? So that's the number 1 thing. We have to assess their chest pain. Number 2 thing is, okay, so I told you, oh, my chest hurts. Oh, all right. So we're pretending we're on the phone with 911. What about history of chest pain? Is this the first time that you've experienced chest pain? Or is this something that happens all the time? You know, is this happening with, you know, were you cutting the grass? What were you doing? Tell me more about what is taking place when this chest pain occurred. Do you have nitroglycerin? So Carly, you do. You have nitroglycerin because you had chest pain before. All right. So Miss Carly is going to take her, she's going to put her nitroglycerin. We're going to say she has a little spray. She's going to spray it under her tongue. Let's see. Alexia, you've been quiet. What are we going to tell her to be mindful of? What is going to, when our goal for, so she has chest pain. Our goal is to decrease that chest pain, right? What might be some adverse reactions with the nitrate that she just received?
This headache?
Yes, headache. So what is, with that headache, what might, Catherine Bonaventure, what is something else that might happen with that headache and that quick reduction, that quick vasodilation, and that quick drop in blood pressure? What might happen to her?
She could get dizzy.
Yes. What should she do, Haley Holmes?
They need to be sitting down when they take their medication.
Yes. Yes. So y'all are hearing, y'all are understanding. So those are nitrates. Those are the important things you need to know about nitrates. They either start with nitroglycerin, I can't think of the second one. Yeah, just nitroglycerin. That's why, because it's just nitroglycerin in different forms. There's transdermal patches, there's ointments, there's oral, and then there's parenteral. And then isosorbide is the other common drug. All right, calcium channel blockers, Essence. They are considered a vasodilator. How do they work?
Oh, I'm not sure.
What do they, does anybody know how they work? Does anybody remember?
Basically, relax the smooth muscles.
Beautiful. Yes, they relax the smooth muscle. The heart is a muscle. They're relaxing that smooth muscle and they're decreasing those calcium ions. You know, and our calcium, our electrolytes in our body talk to, I mean, like I said, I always simplify it for y'all, but you know, there's a whole lot of stuff happening behind the scenes, but at the end of the day, the electrolytes in our body are telling our body what to do, right? They're either telling our smooth muscle what to do, or they're telling, you know, our potassium is telling our, you know, the sodium and the potassium, all that stuff in our body is regulating something. There are regulators. So if we're slowing the movement of those calcium ions, then at the end of the day, we're relaxing that smooth muscle. When we relax the smooth muscle, Brendan, one of three things can happen. They're good things. They're responses that we want. If we're having chest pain, what's our expected response? Like, okay, so if we have chronic chest pain and we already kind of answered that. It's relaxing the muscle and it's chilling out the heart. What might happen to our blood pressure when we take calcium channel blockers?
It's going to decrease.
It's going to decrease. And then what might happen to, if we're having some extra firings, what also might happen? It could be, I guess I'm making my questions complicated. It could regulate our heart rate too.
Yeah.
So I made those questions complicated, but at the end of the day, calcium channel blockers can treat several things. So they're a great drug. They can treat chronic angina. They can be antiarrhythmic drugs. So they can treat problems with conduction issues, electric issues in the heart, and they can lower our blood pressure, okay? It's 11 o'clock, so I know y'all are ready for me to be quiet, but we did make it all the way through chapter 35 and chapter 36. So y'all understand kind of, do y'all have any last minute questions before we get off? On that last slide, on the last PowerPoint that I posted, all of that stuff under nursing process, that should look familiar to you because y'all told me that stuff. You told me how you're going to instruct your patient. When we're evaluating, we're seeing if the medication worked, right? And if it didn't work, we're going back to the drawing board and we're telling them to, you know, call EMS, or we're telling them, you know, what to do from there. So any questions? Y'all are kind of quiet today. Were y'all overwhelmed today?
I have a question.
Yes.
For tomorrow, the assignment that you want us to turn in about the study tour, you want those medications on the one from 404 through 408 and then 416 through 418?
Yes, and I want you to point out, so I want to say this. On page 418, there are some agents used for pulmonary arterial hypertension. So pulmonary hypertension is not the same thing as just regular hypertension. That's hypertension within the vessels going directly to the pulmonary artery. So those drugs, I'm not going to have you memorize right now, okay? So you can put an X on that. We're not going to memorize those right now. But the same drugs that are vasodilating our arteries peripherally, I'm not saying drugs, we're going to have drugs that are going to vasodilate those arteries at the pulmonary sites. But I'm not going to have y'all memorize those. So you don't have to do those. They're at the bottom of page 418. The other ones, I want you to pick out something, figure out a way to memorize them, and then we'll do some review with that. But actually, you don't have to turn that in. Forgot who was asking me. Was it Kat that was asking me? You don't have to turn that in until the day of your test, because I want you to make something and I want you to use the crap out of it between now and your test. Like, I want you to make something that works for you. If it's flashcards or if it's a flip game or if it's a song, it does not matter to me. But think about a way that you can remember these, you know, the big hunks of drugs. I know that y'all aren't going to memorize every single one, but y'all have to be able to pick out beta blockers and you have to be able to pick out nitrates. And if I said, explain to me, just like Brendan just did, if I did I'm not gonna, but if I said, Brendan, give me one example of a calcium channel blocker and tell me how it can work to decrease blood pressure, I want you to tell me. And I want you to be able to tell me, Catherine, what you might monitor when you're given a beta blocker and what's an example of a beta blocker. You don't have to specifically, I'm not giving y'all assignments, but that's how I need y'all to start thinking. That way, whenever I give y'all the test, you're not so taken back and you just don't even know where to start. So start teaching yourself, start sitting down and making, if it would help, if y'all want me to try to scan these in, I can. This is just kind of ways to look at it so you can remember stuff. Would it help if I scan those in for y'all? Okay.
Do you just want us to memorize like the like, I'm so confused, like the names that go under nitrates, or do you want us to memorize the medicine, the trade name, the adverse reactions, all of that?
So the best way to do it, you need to know those subcategories under antihypertensives, and you need to know the main drugs in those that go beneath each one. So like the main drugs of beta blockers, all end in OLOL. So if I gave you a list, you could kind of pull those out for me. And then as far as the adverse reactions, I know you're not going to remember them all together individually, but you need to say, like for ACE inhibitors, for example, ACE inhibitors, their main side effect is that they cause a dry cough, and their main thing that you need to know as far as the adverse reaction is that dry cough and, hepatic and renal issues. So pull out those main things. And I'll try, I can't tell you everything you're ever going to need to know forever, but I will list like the top 20 blood pressure drugs for y'all. I'll kind of try to give y'all some resources like that so that y'all can pull that stuff out, so that you're not so overwhelmed, because I know it does get overwhelming. But I think if you can remember kind of the big high points that I pointed out to you today and start memorizing some of those drugs, you'll be okay. Y'all have any other questions? I know we're over our time.
Do we have to know the dosage ranges?
No, you do not have to know that. That's what your drug book is for. You just need to know the general stuff, and you need to be able to apply, just like we did just now, apply the nursing process to the administration of these drugs. So if I told you that, if your patient said, I stopped taking my blood pressure medication, and I listed 4 questions that you could ask as a nurse to further investigate that, then I will want you to be able to do that. I would want you to be able to pick out the most appropriate response.
So for the study tools, it's just you want us to do the ones on page 405 and
Let's see.
So
Yes.
405 through 408.
Yes, and then you could do I would probably do, just for your own good, a separate study tool for the ones on page 416 and 417.
Okay.
So you don't want all of them, or you want?
You said, do I want all the drugs?
Yeah.
Was
You
that
said something like do it separately for 416 through 418, so you don't want all. Like, I don't remember.
I guess I'm making it complicated. I truly don't care how you do it. My only goal with the study tool is for you to have a way to remember your drugs. So if you, in my brain, it makes more sense to do them separately, to have one with antihypertensives and one with anti-anginals and vasodilators. But if you want to make a buttload of flashcards and you just want to make big things, one of them that says calcium channel blockers, one of them that says antihypertensives, and you want to have a stack of drugs and you want to put them in the correct pile, you could do it any way you want to, Kat. Like, it's not something to make it complicated. It's just so that you can somehow figure out a way to memorize these drugs. So I'm not going to go through with a check mark and say, oh, she has that one on there, she has that one on there. But I want you to be able to have a way to remember them. And you can call me because I know everybody's probably itching to get off. If you want to call me or email me, I can talk to you a little bit more about it and give you some ideas. And you can tell me specifically how you study, and then I can maybe help you figure out the best way to do that. Does anybody else have any other questions? All right, thank y'all for being attentive. Kat, just email me if you have, or you can call me or whatever. I'm going to be free, and we can chat about it a little bit more. Or they can hang up and you can stay on if you want. All right, I'm done with y'all. Y'all have a good day.